and welcome to From Harm to Home, the Westminster Violence Against Women and Girls Housing First podcast. My name is Louisa and I will be your host for this series, guiding you through the exciting and innovative world of the Westminster Violence Against Women and Girls Housing First project. The project provides housing and long-term wraparound support for women with experience of long-term homelessness, multiple disadvantage and any form of violence against women and girls in Westminster in London. We are making this podcast to showcase some of the amazing partners and people involved in this project, to create a platform for the women accessing the project to talk about their experiences, and more generally to tell the world about how it works and what we have learnt along the way. In this episode, our podcast producer and business support officer at Standing Together Against Domestic Abuse, Holly Ringrose, interviews me about some of the key outcomes from the Westminster Bulwark Housing First project and recommendations which tell us where we need to go next. Hello, Holly.
Hello.
It is wonderful to have you out from behind the scenes of podcast production to lead on this interview today. Fire away. First question.
Thank you. No, thank you for having me. So the first question we've got is an introduction to the evaluation and the impact report. So as we reflect on the 5-year journey of the Westminster Violence Against Women and Girls Housing First project, what key insights have emerged from the evaluation process so far, and how has the data gathered shaped our understanding of the impact this initiative has had on women experiencing homelessness and multiple disadvantage, and what are the most significant findings you would highlight?
That is a long question, Holly, but I will do my best to answer. So in terms of insights that have emerged from the evaluation process so far, thinking about the whole 5-year journey, not just this year, I think some of the outcomes that we've had from this year are obviously kind of relatively similar to last year, and I think year on year we're just, there's becoming more solid evidence for how the way the service works is real evidence for the need for a gender responsive approach in housing first. Women's with long-term homelessness who have multiple disadvantage and VOG have different needs to their male counterparts, and experience of domestic abuse and VOG really does benefit from specialist domestic abuse input, housing coordination. I suppose, the specialist domestic abuse input that has been adapted to meet the needs of this group of women. So I think in terms of key insights that have emerged from the evaluation process so far, I think, it's definitely the evaluations over the years have, I think, are unequivocal evidence for the benefits of a gender responsive approach to housing first and why it's needed for this group of women. In terms of your second question about how the data gathered has shaped our understanding of the impact this initiative has had on women experiencing homelessness and multiple disadvantage. I think some of the most significant findings this year, I suppose similar to previous years, is that domestic abuse and VOG, it's the key thing that puts women's tenancies at risk. It's the key factor that you really need to consider in order to think about how we can support women to sustain tenancies. It impacts everything. It impacts women's engagement with the Housing First workers. It impacts women's engagement with other services, much needed partners such as health and substance misuse services, mental health services. It really is the key barrier, I suppose, to stopping housing first working for women. So it's a very, very important place to start, really, to have that specialist domestic abuse support adapted for this multiply disadvantaged group of women, of course, but have the support coming from a VAWG and domestic abuse specialism is all important. And obviously, you know, we're 100% not impartial on this, since the housing coordination element was something that Standing Together developed and continue to coordinate, but having housing coordination as well makes all the difference, I think, as well.
Amazing, thank you so much. No, it was a big question, and that was a great answer. So thank you. Talking about housing and tenancy engagement, how has the Westminster Violence Against Women and Girls Housing First project approached housing and tenancy engagement for women with lived experiences of domestic abuse and homelessness, and what strategies have proven most effective in ensuring long-term housing stability and tenancy success?
In terms of tenancy sustainment and success, currently tenancy sustainment is 95% across the 5 years, and then it's 90% this year. It's dropped a little bit from last year because we did have a woman who wanted to relinquish her tenancy after experiencing an incident of VAWG in her flat. But these are still really good numbers, I think, and really important to remember that. I suppose I was just talking about the housing coordination, but the housing coordination that we do at Standing Together is really important. Upskilling housing providers to understand the needs of the women and engage in the process. So if something does go wrong with the tenancy, that they are involved in that process. So that really makes a difference. It maximizes the possibility of the woman being able to maintain that tenancy. So that makes a big difference, I think. Having that housing coordination there is really key. I think as well about making sure that women are given lots of choice over where they live, and that they have the right to turn properties down if they're not right for them. That's also really important. Solace being the support providers, their ability to support women who do have current perpetrators, who, you know, often follow them into these tenancies. I think their ability to work with maybe the services supporting those perpetrators as well. I think, yeah, it's really about that partnership response and kind of clear communication between all the relevant agencies, really. I'd say the housing coordination makes a big difference to housing stability and tenancy success.
Thank you for that answer. That's really insightful. I think talking a bit more about the women in the project, can you provide a bit of a breakdown of the demographics of the women being supported through the Housing First project? What are the most common experiences or challenges that they face? And how does the programme cater to the specific needs of diverse groups within this population?
The full analysis of the data is in the report, but just headlines. So in total, 48 women received support from the project in year 5. 10 women were closed to the project over the course of the year. It's best to see the report for kind of some of the reasons around this. And then at the end of year 5, 38 women were receiving support from the project. The average age of women supported by the service in year 5 was 42. In terms of ethnicity, just over 70% of women supported by the project in year 5 identified as white. In terms of gender sexuality, all of the women being supported at the end of year 5 identified as cisgender women, 3 identified as bisexual. There were quite a few don't knows. on that one. And disability, 23 women reported having disability, making up 60% of the total number of women being supported by the service at the end of year 5. In terms of what are the most common experiences or challenges they face, and how the programme caters to the specific needs of diverse groups. I think there are some barriers there. So the Westminster Walk Housing First project predominantly accepts referrals for women in the Westminster rough sleeping homelessness pathways, and we know that they are predominantly white. We also know that they're predominantly over 30, I'd say. This group that Access Housing First services who experience long-term homelessness, they are, due to the kind of they have very high needs, and due to this, they are more likely to be a little bit older because they have been homeless for a longer amount of time. So I think it says something about what we know, and I think, the work of the Rough Sleeping Women Census, there are a lot of women who are less visible, who may well meet the criteria for the service, that are just not being picked up because they aren't known to homelessness services potentially. I think Black and minoritized women, potentially much younger women or older women, so 60 or above, that may be being missed, I suppose. And I think there's something there about the need to increase referrals from other organisations, but also I think the local authority, I think it's really important to do things like the census, so you do find out as much as possible about a group of women that are not seen in the current pathway with the current processes, etc.
No, thank you so much, Louisa. I think it's really interesting that you mentioned that the average age of the women in the project is 42, considering that we know from, like you say, from the women's census that Single Homeless Project carry out, that the average age of death for women experiencing homelessness is 43. So it seems that it's a really crucial time period in their lives to have that intervention and the specialist gender responsive support that Housing First can provide for them. So thank you for that. The next question, speaking a bit more around sort of the challenges and the experiences that the women in the service face, given the prevalence of domestic abuse among women accessing the Housing First service, how does the project ensure the safety and security of these women both during the housing process and once they're settled? What protocols are in place to address ongoing safety concerns related to perpetrators?
Yeah, so in terms of processes that are in place and what the service, I suppose, does around VORG, I think, as I said earlier, Solace Women's Aid, specialist provider, they've got those skills and expertise around domestic abuse and VORG, which they've adapted for women experiencing multiple disadvantage in a Housing First context. So adapted ways of doing risk assessing risk around domestic abuse for this group, and adapted safety planning as well, kind of starting from kind of collaborative safety planning as well with the women. So the team know how to, I suppose, gently raise the subject of domestic abuse and VAUG. It's got to be approached very slowly and carefully with this group of women who are experiencing ongoing abuse and at high risk of serious harm from perpetrators. We've seen some really positive outcomes. So the team made 37 MARAC referrals and supported cases through this process. So that's been really important. And yeah, 15 women were actively discussing domestic abuse or VAUG with their worker at the end of the year, which is a huge thing for women who, may have disclosed domestic abuse and VAUG to services before and not been believed or been disregarded. It's a massive thing that they trust their workers enough to be able to do that. And I think as well, I think the relationships of trust with the workers, that bond with the worker is so key. Workers do build up trust with women, and yeah, women do can take a while, but they do open up about domestic abuse, and that is a mitigating risk factor in itself. That, for the first time, probably in a very long time, they are open about it, they are talking about it, they are engaging on some level with their worker about it. So yeah, that's really important, and I think the Solace team do a really good job of that.
Thank you so much. No, that's really interesting, and it's really valuable, I think, to have a forum like this to be able to talk about how crucial it is just to have a safe space to be able to slowly open up. It's not something that happens overnight, but to have that stability, probably like you've said, for the first time ever, to be able to open up and talk about their experiences is really valuable. Moving on to a bit more about kind of their health and well-being, we've spoken already about the women's census that Single Homeless Project do, and we know from some of their reports that 74% of women experiencing homelessness have a physical health issue, and similarly 64% also face mental health issues. On that kind of topic, how does the Westminster Violence Against Women and Girls Housing First project integrate health and wellbeing support, particularly for women with mental health needs, substance misuse issues, or trauma from domestic abuse? And how do you measure the impact of this holistic support on their overall recovery and stability?
Yeah, so in terms of how the project integrates health and wellbeing support, obviously it doesn't have any dedicated, health professionals or nurses or anything within the service. Some Housing First services in America were designed to have their own teams like that, which is quite amazing, really. But obviously in Housing First in England, it is about, partnering with and making links with existing health and wellbeing services in the local area. So this year, the project has worked really well with specialist homeless health services in Westminster, of which Westminster is very lucky to have quite a few. I think 14 of the women were engaging with a homeless health service around their mental or physical health at the end of year 5. And I suppose that's testament to how those services have been adapted to meet the needs of homeless people experiencing homelessness. So they are more flexible, they understand multiple disadvantage and the barriers that this creates for people in accessing health services. So yeah, it's really positive to see that, quite a large proportion of the women were engaging with one of these, specialist homeless health services at the end of year 5. So that's made a really big difference. Another, I think, key partner around health is substance use services, so drug and alcohol support services as well have been really key partners. 16 women were engaging with support from a drug or alcohol service at the end of year 5, and that's again quite a high number. So that's really important. As well, the service is focused on women's health. It can be very difficult for women who are experiencing domestic abuse and addiction issues, have mental health issues, to engage with healthcare, full stop. But 3 women have actively engaged with women's health support this year, cervical screening, breast screening, specialist support around menopause, and 3 women have actually been prescribed with HRT as well. So that's really, really important. And I think that's something that would not have happened without the intensive, flexible support that the project can provide in supporting women to access appointments and attend these appointments too. I think there have been some really positive outcomes around health and well-being. In terms of measuring the impact, I think it's a little bit anecdotal. We've got some really good examples of person-specific outcomes, and we can obviously count up the number of women who are engaging with specialist homeless health services, etc., drug and alcohol support. So yeah, we've done it like that, really.
Thank you so much, Louisa. No, I think that's really interesting, and I think it goes to show that partnerships really are crucial when it comes to providing support. We talk a lot about this within Standing Together with our coordinated community response, and how crucial it is for survivors, especially survivors that are experiencing multiple disadvantage, who come into contact or should come into contact with so many different services, and having a place to tie them all together, and having that advocate really through the Solace team, and having somebody on their side is really crucial. And I think, as you've said, around the sort of anecdotal measures of impact, I think it's also really important that we do see the women beyond the numbers that we see within this impact report, and that we see them as exactly what their experiences are, and see them for who they are, rather than just statistics and figures. And actually those person specific wins and celebrations are really important and crucial for this project. Talking about stability a little bit more, this is our second to last question now, around sort of social and financial integration. What steps are being taken to support the social and financial integration of women who have been housed through the Housing First project, and how does the programme help them access things like education, employment opportunities, and to gain financial independence in order to rebuild their lives?
Yeah, definitely. So obviously financial and economic abuse and control is a very common tactic of perpetrators of domestic abuse. So for the women on the service who are currently experiencing domestic abuse, just a snapshot of the data from the last quarter of year 5 showed that 5 women were being financially exploited by their abusers. And 2 of these women's benefits were being paid directly into the abuser's bank account. So I suppose it's the role of the Housing First team to just support women to maximise their income, access all the benefits they're entitled to. It's also really important they're around when things go wrong with the benefits, which invariably they do, and they're not able to sort that out themselves. So to be around to kind of pick up those letters, be on the phone to the Department for Work and Pensions, etc. Open bank accounts too. In terms of social integration, that I think for a lot of women, they feel quite isolated from society, from their community. And again, this is another common tactic of control used by perpetrators. But I think we found that the impact is still felt even when women are no longer in that relationship. That isolation can mean women are estranged from family members and friends. A lot of women have lost children to removed from their care as well. So when a woman doesn't have contact with her kids, with her family, with her friends, doesn't have a social support network, moving into a new community can be and a new tenancy can be a very isolating experience. And obviously they feel great stigma and judgment by society in general. I think the women have highlighted, and that's been found across the 5 years and evaluations every year, that how alienated this group of women feel from society. So Housing First workers put a lot of effort into meaningfully engaging women, and encouraging them to engage in, I suppose, meaningful activities. I mean, the definition of that is broad, but reading, sport, exercise, creative pursuits. The Housing First team have organised 2 pamper days where women had their nails and hair done as well, which they enjoyed. 5 women were supported to engage with education, volunteering and training. 1 woman started GCSEs in maths and English, and another enrolled in her local college for ESOL classes. And we know as well that the service worked really hard to connect women with family and friends. 1 woman met up with her son after not seeing him in person for 5 years. So I think it's things like that that really do make all the difference.
No, totally. I think it is really crucial that there is that Solace Housing First worker there for the women, to help them recognise that there is that life beyond homelessness, and they are entitled to take up space and to get involved in other opportunities, and to, it's never too late to, like you've mentioned, the woman that's gone and done her GCSEs in maths and English. It's never too late to reach back out to family. And I think you mentioned about recognizing women as mothers, even if they don't have their children with them, and having that part of their identity be sort of affirmed and validated through the service is really crucial. And I think it's those stepping stones that sort of pave the way and build that relationship between Housing First workers and Solace and the women that helps them to then feel that stability to open up, like we've discussed earlier, about their experiences of domestic abuse or VOG, or share any safety concerns they have, and I think that relationship really is truly crucial. So our last question, speaking a bit more about our sort of the next steps, and I know we kind of asked a similar question when you spoke with the women in the previous episode. As we reflect on the success and ongoing challenges of the Westminster Violence Against Women and Girls Housing First project, what is the key call to action for government, local areas and support providers, and what do we need to see happen in terms of policy, funding and service delivery to ensure that women experiencing violence against women and girls, domestic abuse and homelessness receive the support they need? And on a personal level, what can each of us do to help further this mission?
Yeah, definitely. So yeah, in the report this year, we tried to be really clear with some calls to action / recommendations from the report, for government, for local areas, for service providers. So yeah, I think some of the key ones are, in terms of policy and funding. The government have talked about developing a Housing First strategy and scaling up for Housing First women across the country. We'd want to see specific reference to the needs of women and the need to take a gender responsive approach to developing and delivering Housing First services within that strategy. The strategy should also be accompanied by dedicated cross-government funding to scale up Housing First across England. Housing First saves a lot of money to the public purse, but it also, there are massive savings for health, there are massive savings for the criminal justice system, and I'd like to see a real cross-government funding approach, I suppose, that reflects that. In terms of for local areas, local authorities, I mentioned the Women's Rough Sleeping Census earlier. This is such an amazing intervention. We think all local authorities should lead and deliver an annual Women's Rough Sleeping Census, because we just need to know, we need a full picture. You need to know the full picture of homelessness in your area to make strategic funding and commissioning decisions accordingly. And at the moment, we know that the current, we are not seeing a lot of women, and a lot of decisions about services, etc., and what is needed is being made without the full picture of their experiences. Obviously, I think, as I've said earlier, involve org sector partners when planning and procuring housing first in your area. Solace do bring such specialism to this. Obviously, it's adapted specialism for survivors of multiple disadvantage, but it's very important to have that specialism. So I think that partnership between VORG and homelessness is really important. Ensuring there's also budget for dedicated housing coordination within the Housing First team as well, because that makes such a big difference in making sure that women receive appropriate offers of housing. And in terms for service providers, I mean, there's lots in the report, so I'd really direct people to the report to read some more about the learnings, but just make domestic abuse and VORG a really core priority within your team. Ensure staff have access to training. And I mean, yeah, consider integrating some of the learnings from this report into your day-to-day practice. So in thinking about VORG risk assessments and gender responsive kind of safety planning as well. Yeah, forge or strengthen relationships with local specialist services that can support your team around domestic abuse and VORG. And obviously consider the proportion of Black and minoritised people within your service, and be thinking about the barriers there and what is needed to overcome those as well. So yeah, just a few things, not much.
Just a few things, but I think all of them equally as important as each other. I think it's really clear that for Standing Together and our partners in the project, Solace and the housing needs team within Westminster Council, that we are going to continue beyond this year and into the future to break the cycle of abuse, and together, and hopefully also with our listeners and government and service providers listening to this and taking this on board to ensure that every woman has a safe place to call home.
Absolutely. Thanks so much for coming out from behind your laptop screen, Holly, and interviewing me today. I really appreciate it.
No, thank you so much for having me. It's been a pleasure.
If you would like to find out more about the Westminster VORG Housing First project, please visit our website at www.standingtogether.org.uk. This podcast is written by me, Louisa Steele, and produced and edited by the amazing Holly Ringrose. If you enjoyed this episode and you'd like to support the podcast, please subscribe, leave a rating and review. To stay up to date with the podcast, you can follow us on the Multiple Disadvantage and Homelessness team channel on LinkedIn. Thank you for listening.